Oh, Hilton stay, your beds are soft and cozy. No lumpy couch, no stiff futon, no shower line at crack of dawn. Oh, Hilton stay, a holiday you're saving.
When you want holiday comfort you can count on, it matters where you stay. This season, enjoy spacious, comfortable rooms and friendly service when you book with Hilton instead. Hilton for the stay.
Thursday Night Football is on, and it's only on Prime Video.
Brilliant, just brilliant.
This week, the West Coast action heats up when the Rams meet the Seahawks in a huge divisional showdown. Coverage begins at 7 p.m. Eastern with football's best party, TNF Tonight, presented by Verizon. And don't miss the Broncos and Chiefs on Christmas night. It's Thursday Night Football, only on Prime Video. Not a Prime member? Not a problem. Simply sign up for a 30-day free trial. Restrictions apply. See Amazon.com/Amazon Prime for details.
Welcome to the Dr. Raj podcast with Dr. Raj Dasgupta, a show all about educating patients, students, and aspiring doctors about better patient care. Dr. Raj is a quadruple board-certified physician and associate professor at the University of Southern California. He was a co-host of the TNT series Chasing the Cure with Ann Curry, as well as a regular on the TV show The Doctors. And now, here's our show.
Hi, everybody, and welcome to You and Your Brain, The Truth About Sleep, the 8th webinar in the series devoted entirely to women and their brain health and brought to you by HealthyWomen, Prevention, and the Women's Alzheimer's Movement at Cleveland Clinic. My name is Tamsin Fidel. I'm so glad you're here. I am a journalist, author, and menopause advocate, and I am so happy to be with you today to be having this important discussion around sleep and just how essential it is for our overall health. As I'm sure you've all heard, sleep plays a really crucial role in every aspect of our physical and mental functioning, as well as to our body, as eating, drinking, and breathing does. Unfortunately, though, most adults, and women in particular, from midlife on, experience difficulty sleeping at some point, with the quality of sleep often getting worse as we age. So today we're going to be speaking with leading experts who can talk about the benefits of good sleep hygiene, the practices that make for a good night's sleep, and practical advice, and also solutions that you can use as soon as tonight. So let's get started. Joining me today, Dr. Raj Dasgupta, an ABIM quadruple board certified physician specializing in internal medicine, pulmonary, critical care, and sleep medicine. He is the associate professor of clinical medicine, University of California, Riverside School of Medicine, and the associate program director of internal medicine residency at Huntington Health. Dr. Raj, welcome.
Hey, nice being here, everyone.
We also have Dr. Monica Malampalli, the executive director of the Alliance of Sleep Apnea Partner and a member of the HealthyWomen Women's Health Advisory Council. She brings a really unique perspective to women's health as both a biomedical scientist and a women's health advocate. Welcome.
Thanks, Tamsin. Thanks for having me.
And rounding out the panel, please welcome Dr. Nancy Foldberry-Schaefer, professor of neurology at Cleveland Clinic, Lerner College of Medicine, and director of the Cleveland Clinic Sleep Disorder Center. She's certified by the American Board of Neurology and Psychiatry in neurology, clinical neurophysiology, sleep medicine, and epilepsy medicine. Welcome to you as well, Dr. Nancy.
Thank you.
So I would love to start today by really talking about the real benefits of what we call or we think of as quality sleep and some of the dangers of sleep deprivation, because I think it's so important, especially as this is a topic we're seeing over and over again out there. So Nancy, I want to start with you. What is actually going on in the brain during sleep that makes it such an important part of our brain health?
Yes, so it's such a key question. For centuries, humankind thought that sleep was an inactive process, a passive process, where the body and the brain were just dormant. But we learned with the discovery of REM sleep about 75 years ago that sleep is actually a very active process. Many different things are happening in the brain during sleep that promote wellness, health, and even maintain survival. So we know now that sleep is critically important for all biological processes, and it's important for us to be optimized, during wakefulness to have slept. And literally every cell and every organ of our bodies and brains benefit by sleep. There are a number of different types of sleep. So most people know that there's cycling of sleep. We tend to have 5, 6, 7 cycles of sleep per night. These are 90-minute cycles. We enter into non-REM sleep, stages 1, 2, and 3. Stage 3 non-REM is also known as deep non-REM sleep or slow wave sleep. This is a very important stage of the sleep for brain health. And then after non-REM, we go into REM. We used to think that REM, rapid eye movement sleep, was really the most important stage for brain health. REM has a lot to do with plasticity, brain development, and learning. But really in the last few years, we've shifted toward recognizing that slow wave sleep, deep non-REM, is very important for cognition, particularly with aging. It's also important for many other things: immunity, neural restoration, general restoration. So when we're deprived of slow wave sleep, we tend to feel unrestored or feel sore and achy. I'd like to mention 2 things that critically answer your question that are relatively recent or more recent discoveries. One was really for me like a mind-blowing, groundbreaking discovery several years ago that leads to us better understanding the role of the brain in sleep. And that was the discovery of the glymphatic system. The glymphatic system is a waste clearinghouse, I like to call it, in the brain. It functions mostly in deep non-REM sleep, and it clears the brains of toxins that accumulate during wakefulness. A great study was published a few years ago that recorded PET scans, so PET, nuclear medicine scans, that were binding to beta amyloid, the peptide that constitutes the plaques in Alzheimer's disease brains. And it showed that in cognitively normal middle-aged people, sleeping 6 hours led to a significant accumulation of beta amyloid in the brain relative to 7 hours and 8 hours. So just cutting sleep short, cutting slow wave sleep short, critically affects the brain health. The second great example is more along the lines of the importance of REM sleep. And this tells us that in certain parts of the brain, depriving us from sleep literally changes the morphology of neurons, brain cells, and their synapses, the way neurons connect with each other. Our neurons have to connect with billions of other neurons in order to think clearly and to function optimally from a cognitive standpoint. And this study showed, particularly in the hippocampus, which is a deep part of the temporal lobe, the earliest structural change in Alzheimer's disease, that chronic sleep deprivation affected the way these neurons functioned. So those are just 2 of many examples of what the brain is doing to promote sleep, and how when we deprive ourselves of sleep, how our brain is affected.
I mean, it's so important to talk about. We talk about the brain, and that's so many areas it's affected. But Dr. Raj, how does sleep affect some of the other body systems? Because we certainly know it does.
Sure. So, I always like to start my conversation with kind of like that wow factor, which is, we sleep almost a third of our lives. It blows my mind. And people don't really appreciate that statement until I put it into, if we all live to the healthy 90 years of age, I wish that on everyone, that's 30 years of sleep. And when people ask questions like, hey, what does it do to our brain, our body? We only know the tip of the iceberg. There's so much more to learn about it. But yes, when I think of good sleep, and that's hard to get, it's got to be the 2 Qs, right? The quantity of sleep and the quality of sleep. And the quality of sleep, I'm going to echo what Nancy just said, is getting to the deep stage of sleep we call delta sleep or slow wave sleep, and REM sleep. It does amazing things to us. So, I was really going to talk about the brain. You know why I'm here? My dad's got Alzheimer's. And, I am in the trenches. I know how it stinks to have it, what happens to your brain. And really, I'm a big fan of changing, your good pillars of health, whether it's going to be the diet, the exercise, sleep, just mental status. But I'm not going to skirt around your question. I do want to talk about 2 things. I do want to talk about cardiovascular health. And I do want to talk about the immune system. So when we talk about, getting poor quantity and quality sleep, studies have shown when we talk about chronic insomnia or untreated obstructive sleep apnea or just being sleep limited and deprived, poorly controlled diabetes, type 2, high blood pressure, cardiovascular disease. And when I think about the heart, why we have nighttime, everyone, is because most of us at nighttime, our blood pressure kind of goes down, our heart rate goes down. Gives our cardiovascular system a break, and you can imagine if you're not getting a break at night, that's twice as hard your heart has got to work. So that's one thing. The other thing is the immune system. And I got to bring it up because I'm a pulmonologist in critical care. So I'm always seeing sick people. And I know that during the wintertime and all, it's kind of like if you are going to have a night of being sleep deprived or chronically sleep deprived, that one morning you wake up, you get that tickle in your throat. The next thing you know, you got the runny nose. It's just amazing how sleep plays a key part of our immune system. We all want to be healthy nowadays. So these are just two things of the many things that sleep does for us. So sleep is definitely crucial. I'm super happy to be here and talking about this.
Oh, so happy to have you. And I like how you talk about that because you put it in such practical terms that you can picture it. Like you can picture your blood pressure going down, your heart.
Totally.
You don't think about those things, when we came from the days of bragging about a lack of sleep, sadly enough.
Well, that badge you wear right here, like I can sleep when I'm dead,
4 hours, I got it. So Monica, let me ask you, because my dad suffers from sleep apnea, but when people don't sleep enough or don't get restful sleep, like they wake up due to sleep apnea, what are some of the long-term consequences of that? And then the second question to that is, why is sleep so important in that area as well?
So thanks, Tamsin. And I think Dr. Raj and Nancy did a great job even explaining why sleep is so important. So even in understanding with what's happening during sleep apnea. So let me just explain. So during sleep apnea, there are pauses in your breathing, right? So patients with sleep apnea don't breathe. That could be because of the obstruction, a possible obstruction. That's why it's called obstructive sleep apnea. And so when that happens, that wakes the brain up. That's called the arousal. And the brain wakes up. The brain is not able to do what it's supposed to do, just like Nancy explained. There is a job for the brain to do during while you're sleeping. So you have this interruptions in your sleep that puts you at risk for many other conditions, or even not having that quality sleep that Dr. Raj just beautifully explained. The risk for cardiovascular disease, or the immune function, again leading to maybe type 2 diabetes and other conditions. So I think in a way that we see sleep disorders can tell you a lot of things that's going on, right? I mean, it directly speaks to how you're sleeping. So if you're suspecting that you have either sleep apnea or even insomnia, which is trouble even falling asleep, I think it's worth exploring why you're not sleeping and what is causing you not to get the restful sleep.
Yeah, we definitely want to address those things because it is so important for people to have some solutions when they walk away from this today. As a menopause advocate myself, I know difficulty sleeping, one of the most common complaints for women during this transition. So I want to dive into what makes for good sleep and then why sleep patterns might get disrupted by menopause, because I think that that's something important to talk about if somebody wants to address that.
Yeah. Well, I'm not a woman, but I want to answer this question because I studied for this. So for the men who are listening to this, what is menopause? Is not having your period for a period of 12 months. It's highly associated with decreased estrogen levels. And when we talk about these hot flashes, which I learned, many people think, it happens only at night, but it happens throughout the day. And what was interesting, I did some research that there were sleep studies that show that women don't actually wake up when it's the hot flash. You wake up first, then get the hot flashes. Mm-hmm. You get these drenching tuberculosis like night sweats where it's really, really bad. And I felt horrible. And I asked, some of my friends who, really deal in women's health, like what are things now to address it? Of course, lifestyle modifications, be careful with alcohol and caffeine, diet, extra, all these things. But it's amazing how there's new data about based upon your age and risk factors, hormone replacement has a role. You should talk to your primary care about that. But also there's new medication that got FDA approved to help out by regulating the hypothalamus. So I really do feel that, when you go through that perimenopausal phase, and I do see a lot of women because I see them because of the fact that because there's no estrogen, they are at a higher risk for things like OSA at that age, and of course, insomnia. So it's very important to address this. And I'm so glad once again that, I'm here with this panel to kind of show a different perspective about things.
No, I'm so happy you said that. Monica, let's talk about that. Jumping off of what Dr. Raj said, what is normal sleep, and how do we see that changing with age in terms of how long, how many times we wake up, how we feel in the morning, whether we feel rested, and then I do want to go back to menopause of what's going on in a woman's brain around menopause that really affects her ability to get a good night's sleep.
So when we talk about normal sleep, I think normal sleep is subjective. It depends on individual to individual. I mean, typically, again, Nancy mentioned some of this, like there's a window, 7-8 hours might be optimal sleep. Sometimes too much sleep is bad, too less sleep is bad, but it really comes down to the individual. Are they able to get good quality sleep, wake up feeling refreshed? If they're not feeling refreshed and they're tired the next day, then something is not right. Sleep changes over time. With age. So you have to take that into factor. And again, like Dr. Raj said, there are certain things you have to take into consideration and adopt some of the, sleep hygiene tips and tricks that, allow you to get good sleep. For women, I think particularly women need to pay attention to their sleep. There's already a lot of stressors in their life. Especially with young children, then they are going through all these hormonal changes. And it's true, by the time they hit menopause, there's a decrease in estrogen and progesterone levels. And at the same time, that puts them again at risk for, conditions such as sleep apnea and insomnia. Even during menopause, we don't exactly, I don't think we're sure what's happening. We know these hormones have a role. They do play a role on the brain. But what happens is during hot flashes, when some women experience hot flashes, there's an increase in body temperature. And remember, our body is very fine-tuned to these increases in temperatures, right. Including sleep. So that's when your body actually wakes up, your brain wakes up right before you're about to have a hot flash. Mm-hmm. So can women do some things to prevent that? Maybe keeping the room cooler, maybe preventing some of these hot flashes from coming on. That may, help them sleep better. So I think just to be aware of at least the fact that if you're waking up, you're about to have a hot flash. Mm-hmm. That's why your brain is reacting that way to these changes, the subtle changes that's happening.
When the holidays start to feel a bit repetitive, reach for a Sprite Winter Spiced Cranberry and put your twist on tradition. A bold cranberry and winter spice flavor fusion, Sprite Winter Spice Cranberry is a refreshing way to shake things up this sipping season. And only for a limited time. Sprite, obey your thirst.
Does it ever feel like you're a marketing professional just speaking into the void? But with LinkedIn ads, you can know you're reaching the right decision makers, a network of 130 million of them, in fact. You can even target buyers by job title, industry, company, seniority, skills, and did I say job title? See how you can avoid the void and reach the right buyers with LinkedIn ads. Spend $250 on your first campaign and get a free $250 credit for the next one. Get started at linkedin.com/campaign. Terms and conditions apply.
Dr. Raj, what does restful sleep look like if we have to define what that looks like? And I guess we see what it looks like the next day or it accumulates over time.
Well, now I wouldn't know. I have 3 kids, but I have a 4-year-old, a 9-year-old, and a 10-year-old. Oh. But for me, when I evaluate my patients in a clinical sense, like, hey, I always remember what happens at night definitely affects you during the day, especially when we talk about things like insomnia. So I like to ask about daytime symptoms. How are they functioning? Are they showing up to work on time? How are your relationships with the family and friends? So when I think about good sleep in general, I want to echo what both Monica and Nancy said, which is, hey, are you able to get to the deep stage of sleep? Are you getting to REM sleep? Are you having multiple cycles throughout the night? Are you not having multiple arousals and awakenings? All those things are important. Are you having excess napping during the day for no reason? Not that I'm a nap hater. I'm not going to say that, but questions I'm going to ask. So I think that asking daytime questions is very important to figure out what's going on at night.
Yeah, that is so true.
Can I just quickly add something, just because something that Dr. Raj just said, if you're asking people to look at their REM sleep or non-REM sleep, a great way to do that is wearing, some of these wearables like Fitbits or Apple Watch or something that actually shows you your sleep. And I think just even monitoring that, for yourselves and seeing, okay, is my sleep deviating in some ways? Or, even gathering some of that basic information sometimes is useful.
Yeah, that is so true. So you just at least know what you're dealing with or can start to solve it if you're having a problem. Nancy, I want to bring you in here with a twofold question. First, talking about how dementia may impact sleep quality, but also, is there a relationship between women's greater sleep disorders and higher risk factors for diseases like Alzheimer's?
Yeah, great questions. I think that patients with neurodegeneration disorders, dementia and other types of neurodegeneration are sort of known for having dissatisfying sleep, poor quality sleep, not enough sleep. And most of them meet criteria for a chronic insomnia problem. And for me, it's often hard to know what's the chicken and the egg, because when insomnia may develop in the midst of neurodegeneration, but poor sleep accelerates neurodegeneration. We all know like how we feel after a night of really poor sleep, and we know acutely what that does to our brains, and how we speak and how we think and how we communicate is all typically impaired. But when you're in this chronic cycle, one begets the other. And so it's often difficult to know what really is evolving first, the neurodegeneration or the sleep problem, but they become very intertwined at some point. What we really don't know is how intervention studies treating certain sleep disorders in certain populations might then lead to better neurological outcomes. We're in the midst of publishing a study now where we measured the risk of insomnia and the risk of obstructive sleep apnea in the Cleveland Clinic Neurological Institute, tens of thousands of people who did these questionnaires. And we also had disease-based instruments as well. So for example, in our movement disorder center, where most of our Parkinson's patients are seen, tremor patients, dementia with Lewy body are seen, these patients had very high scores on the risk of obstructive sleep apnea and insomnia. And most, I think, intriguing is that those high scores positively correlate with high impairment of their neurological problems. So we've got these intertwined high-risk sleep disorders and high neurological morbidity. And again, hard to know how they are relating to one another, whether there's a causal relationship or not. Another point I think that's important for people with dementia and neurodegeneration is that there are other disorders besides insomnia, like restless leg syndrome and like obstructive sleep apnea that Raj talked about a little bit, that increase in prevalence with age. And we also know that chronic insomnia and RLS are typically more common in women than men, and they probably become increasingly more common with age in women than men. We don't, however, have good studies to know whether it's the sleep disorder in women that might be driving neurodegeneration differently than we know that in men. But we certainly know that it's important, as I think Raj mentioned, we need to make sure that people get their sleep histories taken. It's so easy to just let chronic insomnia go untouched for decades. It's easy to completely miss an RLS diagnosis, which can be driving insomnia. And it's really easy, as Monica might have alluded to miss sleep apnea. Obstructive sleep apnea, what a common diagnosis. We almost all know what obstructive sleep apnea means, but it's so easy to miss it in postmenopausal women. Postmenopausal women have the equal prevalence of obstructive sleep apnea as men. So the prevalence of OSA increases significantly surrounding menopause. And so postmenopausal women have the same risk of OSA as men, but they have an average of a 10-year delay in diagnosis. And that's because older women present a little differently with OSA than men do. So it's so easy to miss them. And think about that window of opportunity where we're missing and we're not protecting cardiovascular health, metabolic health, and brain health. I think one of the other interesting components to sleep quality and sleep disorders in this population of people with neurodegeneration is the story about REM behavior disorder, which I'll fit in here really quickly. RBD is a parasomnia, a disorder that happens during REM sleep of abnormal motor activity behaviors. Essentially, in REM sleep, we are normally paralyzed. And in RBD, the brains of these people, as part of a degenerative process, have a lesion in the brainstem that prevents the muscles from being paralyzed in REM sleep, which is why people with RBD scream and act out dreams and can hurt themselves and hurt others. While RBD is more common in men than women, it certainly affects women too. And the most important part to realize here is that RBD is not a difficult disorder for sleep doctors to diagnose. And 95% of people with RBD will develop neurodegeneration within 10 to 14 years. It is an early biomarker. It is a sleep biomarker, well-established biomarker. And so we have these tools, we have clinical history abilities, and we've got these diagnoses that in the right hands, we could be identifying these potential sleep risk factors that long-term will impact brain health. We just need to really deploy these things on a larger scale in order to optimize brain health for all people who are approaching later years.
Well, I'm grateful conversations like this are happening so people have this information as well, and they can, take part in the partnership with their doctors to ask these questions. So, we talked on the importance of sleep. Let's talk about some sleep solutions, because that's what so many of us are searching for and perhaps would like to implement. Nancy, I'm going to stay with you for a second. Some sleep habits you recommend that people prioritize if they want to maintain cognitive health as they get older.
Yep. So it's important to protect our sleep. I think Raj said sleep. I tell patients, sleep is foundational to health and wellness. It is no less important than diet and exercise. Mm-hmm. And we spend billions of dollars in this country a year on diet and exercise, and we ignore sleep. So we all know how much sleep we need to feel well. I mean, most of us know what that magic number is. It's somewhere between 7 and 8 hours for most of us. And not protecting our sleep directly has these adverse impacts that we talked about on the brain and on every organ in our body. So I educate people. I think when people really hear about some of these experiments, some of the ones I mentioned that directly affect brain health, I think people listen. So I think we need to find ways as sleep professionals to really communicate in ways that people will listen. Simply protecting your sleep and not letting yourself use that time for other things is most important. Mm-hmm. And I think that one of the most important practical steps is to anchor a wake up time, not let it. It's important that we have good sleep quality, quantity, and timing. For example, shift workers who sleep during the day, they may sleep 8 hours a day. They're not getting the same kind of sleep, and they're at high risk for lots of comorbid conditions because of the timing of their sleep. Mm-hmm. Alzheimer's and demented patients tend to fall asleep too early, and their timing can be very disruptive, not only to them, but to their caregivers. Mm-hmm. So if we can help people establish normal timing by setting a wake-up time and sticking to that same wake-up time, then sleep tends to backfill and people tend to be able to get a stable period of sleep. And other tools also might include, for the chronic insomniac, figuring out a way to decompress all that negative thinking. Sometimes we do journaling during the day or make a worry journal. Do those things during the day, put them aside, establish a sleep ritual that's comfortable, make sure your bedding and your bedroom is comfortable, and make sure you're avoiding things that are wake promoting, like alcohol is very disruptive. It helps people fall asleep, but it's very disruptive, particularly to REM sleep, as is caffeine and exercise too close to bedtime.
Great. Dr. Raj, let's talk about this. Is there a difference in that advice? Because that's incredible advice, but for people who can't fall asleep versus you're popping awake in the middle of the night and you can't stay asleep?
Well, first off, I want to make sure I give a shout out because I know it's about the women's and Alzheimer's. And I want to talk about caregivers for 1 second, because my mom is the caregiver for my dad. And for all people taking care of someone with Alzheimer's, it's just as hard for them because when you have Alzheimer's, you have this irregular sleep-wake pattern. It's so hard for the caregiver to actually get good sleep themselves. And not to mention, when we talk about medications for patients with Alzheimer's, they could do a number on your sleep. I'll say a couple names right now. Seroquel, So I just want to make sure I acknowledge all the hard work that caregivers do. But to answer your question, I think about insomnia and I think about how do I categorize it? I could put it into sleep onset and sleep maintenance. But, when I give my advice, it really doesn't change unless we're talking about drugs. Then I'll kind of touch a little bit on that. But I would say this, the take-home message for everyone listening today is sleep hygiene, though we all could improve it a little bit, is not a treatment for chronic insomnia. We all need it. But, when you want to treat chronic insomnia, I think of 3 letters, CBT. Cognitive behavioral therapy. Cognition is going to be your thoughts, behaviors are your actions. And sometimes I'll do CBTR. You know what the R stands for? Dr. Raj. No, it doesn't. No, it stands for relaxation techniques. So I put those all together. So when, I hear about Nancy was giving some tips, if someone has chronic insomnia, of course you want to get to the root cause. But yeah, two of my favorite tips, whether it's sleep onset or sleep maintenance, are going to be, sleep restriction. That's going to be set bedtime and set wake time. Easier said than done, especially on Friday nights and everything. Of course, you always say something called stimulus control, which is simply put, the bed is only meant for one thing. No, not that. I heard that, it's meant for sleeping. So if you can't fall asleep right away in like 20 minutes, go and do things that are non-stimulating in dim light. But I love relaxation techniques combining with all these things. Whether you're a big fan of meditation, I love breathing techniques. I am the pulmonologist, I combine these things. And then if we talk about meds, for the last thing I wanted to say is that meds come in different flavors, right? There's over-the-counter medications people try. Everyone loves their tryptophan and valerian root and all these different things, and magnesium, But then there's over-the-counter meds. Be careful. And then when we talk about prescription FDA-approved sleep meds, I'm not going to throw out some brand names or anything, but that's when I think about if you have sleep onset issues, maybe a little short-acting one. The hardest part is when you have early morning awakenings, because you get a longer-acting med, you'll feel drowsy during the day. It's tough, but like I said, I don't want to be a drug pusher. It really comes down to cognitive behavioral therapy, treat the underlying cause, and many things mimic, insomnia, like, Monica's favorite, obstructive sleep apnea.
Right. I love it, though, because you're providing solutions for people so they don't feel like there's just this one thing they have to do. And if they don't follow that, it's never going to work. Monica, when should people go see a sleep specialist? And then what do you say when you go to them? I mean, do you need to have some, something that you've tracked, or what do you do?
No, that's a good question. I think I would start off by saying talk to your primary care physician first. Okay. I think it's a good idea to maintain some sort of a diary if you're suspecting you have sleep problems, just so that you can take the data, you can take that information to your primary care physicians. Mm-hmm. The problem we have with our healthcare system is sometimes the primary care physicians don't ask about your sleep health. I think it's good to be informed about your sleep health and raise that issue with your primary care physician. Okay. And engage with them in that conversation. Then the primary care physician can decide to refer you to a sleep specialist. The problem, again, is sometimes there's a long waiting time to see a sleep specialist. So there are other things you can do maybe in the meantime. Your primary care physician can also recommend a home sleep test. So in the time you're waiting to see a sleep specialist, you can probably get that home sleep test, and your primary care physician can determine if there is something wrong with you, if you have some underlying sleep problems. And then you can take that information too and go to a sleep specialist who can then order a sleep study, which lets you, actually stay overnight at the hospital and then do an extensive sleep study to figure out if you have a sleep disorder. Mm-hmm. So I always tell people, like, keep a diary. Again, we just don't talk enough about how sleep is important. Just like Nancy said, it's equally important as exercise and diet. And so try and correct that first. Bring it up with your primary care physician. Women, again, a lot of women don't realize they have sleep apnea. They too get sleep apnea. It's just not a man's condition. A lot of women just assume sometimes they have insomnia, but again, those two are related. A lot of the sleep disorders are related. Sleep apnea is related to a lot of the sleep disorders. So I think that's what the sleep specialist can do, tease out these sleep disorders and really give you the right diagnosis and the treatment. So if it's insomnia, you can probably get referred to CBT, that kind of a treatment for insomnia. Or if it's sleep apnea, you may get a CPAP, to treat your sleep apnea. Or if it's some other sleep disorder, there may be medications that they can give. But before all this, I think there are certain things that, again, as an informed patient, that you could do and start those conversations with your primary care physician. And again, you're going through all these hormonal changes. Insomnia peaks at puberty. It again tends to peak at menopause. So again, understanding, how your hormones play a role throughout your, different stages of your life, and understanding how it's impacting your sleep is very important. I just also want to add that on our website, we have a toolkit for women. If they suspect they have sleep apnea, they can actually download this toolkit. On the front side of the toolkit are symptoms that a woman can look at and identify if she has sleep apnea, and use that as a conversation starter with their doctor. On the back side is information for physicians. to again walk through with the woman and decide if she indeed has sleep apnea, and then they can make a decision on how to move forward.
I want to throw something in there. So I didn't know this, but this morning I had to wake up at 5 a.m. to do this interview. It's sleep apnea awareness month. I don't know if anyone knew that.
It's sleep awareness month. No, it's sleep awareness month. I don't think we have sleep apnea awareness month.
No, that's what maybe they lied on the program, but that's what I did in the morning. Yes. And it was kind of cool. And I just wanted to say one thing is that, for OSA, obstructive sleep apnea, I want people who have it, who are worried about getting diagnosed. There are more things than just wearing a mask. We call it CPAP, but you don't have to look like Darth Vader. And when you get the diagnosis of sleep apnea, there are so many things out there, whether it's going to be what we call mandibular advancement devices, our friends from otolaryngology, we call them ENT doctors. They do amazing things, positional therapy, lifestyle modifications. So I just want to promote getting evaluated. That's the most important thing, because there are other options out there, and it does, affect so many parts of your body. So I just wanted to throw it in there.
Oh, thanks, Dr. Raj. And I encourage everyone to please come to our website, apneapartners.org. You'll find a lot of information on sleep apnea and various treatments.
Thank you. Yeah, Dr. Raj, I think that's a really good point too, is that there are other things out there, because I think people get very afraid, like, I'm going to have to wear a mask at night. That's the only solution.
Totally.
And so, I think it's important that, Monica, we're providing other ways to do that. Okay, so let's talk, Dr. Raj, you brought up supplements, you brought up magnesium. So, we know melatonin, magnesium, they've become really popular over the past few years. Do they help?
Sure. So I did this thing. I forgot who was the platform. No, it was CNN. There's something called the Sleepy Girl Mocktail. Has anyone heard of that out there? If you have, just put it in the chat. So they wanted me to know if it really works. So the Sleepy Girl Mocktail was a little magnesium and some melatonin. So magnesium, I would say this much. There's no data that says getting super therapeutic levels of anything in your body to serve anything. So, and of course, when you talk about how do you supplement magnesium, the best way is your diet. But it's no harm in eating leafy green vegetables and some almonds or anything like that. But, magnesium relaxes the body, has some anti-anxiety effect. You know what I mean? Got to be careful. Anxiety, magnesium also causes a little diarrhea, so be careful if you take the wrong diet. So the Sleepy Girl Mocktail is magnesium combined with tart cherry juice. Yeah. And supposedly tart cherry juice has a little melatonin. Tart cherry juice tastes yucky. And when I went to Trader Joe's to get it, it only came in half gallon. So now I have a whole half gallon of tart cherry juice I'm never going to drink in my house. And supposedly if you drink it at nighttime, it makes you sleepy. So it's a big TikTok craze. And my whole answer is kind of like, if it works for someone, I'm not going to badmouth it or anything like that. But when we talk about magnesiums and other supplements, it always comes down to what dose, what route, what form, what time, especially when we talk about melatonin. It's not about cranking up the dose. It's about what time you take it. And everyone's going to say, well, what dose do you like? I'm kind of a conservative type of guy. So I'm like a 3 milligram type of guy, and there's really certain things that melatonin really does benefit for. If you want to shift that circadian a little bit, I love that. And Nancy mentioned something called REM movement disorder. I think we're going that way, but I use melatonin for that disorder at higher doses. So there is a role for melatonin to say, hey, why should you see one of these sleep doctors to help out? But, for TikTok trends, there are a lot out there. Be careful. Be careful. Yeah. And I think it's always good to bring it up with your doctor or sleep specialist.
Yeah, I'm glad you pointed that out. Okay, so these are some of the common questions that we get from viewers. And this one, Nancy, I'm going to address you. This is about napping as a supplement to insufficient sleep or hitting the snooze button. What do you think about those two things? I know we brought up napping briefly, but didn't hit on it too much.
Yeah, napping is appropriate in some situations, but I think if most people who chronically nap every day are probably sleep deprived. And again, we probably get our best sleep in a certain type of structure, a certain type of cycling at night. Sure. Particularly if you're prone to insomnia or fragmented sleep, napping during the day is going to sleep off some of that sleep debt. And that's going to make it harder to fall asleep. And then you may find yourself in a state of chronic insomnia. So I think napping is helpful in short amounts, 20, 30 minutes, not 2 to 3 hours. And it probably should be not done if you are chronically predisposed to insomnia, or you have a chronic problem with timing of sleep, like you're a night owl and you can't get to sleep early enough. So some people think that napping is also a predictor of other bad outcomes and associated with depression and mood disorders. But I think anything like that done in little bits at a time is probably okay. Hitting the snooze button is probably a sign that you let yourself sleep to different times at different days, And so, as Raj said, one of the most important things about chronic good sleep and good sleep hygiene and for treatment of insomnia is to stabilize that sleep-wake period. So if you hit the snooze button once, that's fine. If you hit it several times and you're letting yourself sleep hours longer some days than other days, then you're setting yourself up for an irregular sleep-wake cycle that in and of itself leads to daytime impairments.
So, Monica, I know snoring is often associated with a sleep disorder. Is it always bad to snore, or is it a sign of something?
No, snoring can be a symptom of sleep disordered breathing. So definitely something is going on. It doesn't necessarily mean that you have obstructive sleep apnea, but I think it's worth having that conversation with your doctor and understanding why you're snoring. And what might be causing it. Sometimes for women, I think hormone imbalance can cause even snoring. So again, talk to your doctor if you have the snoring problem. Let them figure out if there's something that's wrong. You can also see an ENT specialist. They can do some workup on you to understand if there's some type of other, obstruction or blockage or something that is affecting your breathing. And by the way, the ENT doctors can also diagnose for sleep apnea. So there's another venue for, have the conversation with the ENTs. I think the other thing I do want to bring up, just as, Dr. Raj brought up on the caregivers aspect, snoring can affect your bed partner. So I think the person who's snoring may not realize that they're snoring, but it also disrupts your your partner's sleep as well. So I think at least for that sake, it's important to have it, have that addressed and see what's going on.
Yeah, that's a good point. And this is another. It's a common question, and somebody as an advocate in the menopause space, it's certainly one that I get asked a lot, and would love answers to too. For women, and any of you can address this. For women going through menopause, are there special tricks or techniques they can use to help them get to sleep? If we're talking about hormones, as the reason that's causing it.
I can try and answer that first. I think the like I said before, I think keeping your room cooler at night, having, now they sell bed sheets, pillowcases that actually give that cooling effect. I mean, trying to prevent some of that hot flashes can be helpful to some extent. And again, staying active, exercising, working out, not cutting back on alcohol, that's another thing, definitely. And again, some of the same sleep hygiene tips can help even for women with menopause. And I think the one thing I do want to mention, I think there's so many supplements available right now. And I think before women start to take those supplements, just have that conversation with your physician. Because with sleep apnea, when there is going to be a pause in your breathing, and this, again, women are at high risk for sleep apnea and menopause, you don't want to be taking supplements that decrease your respiration or lower it. So you have to be very careful about what you're taking. And I think it's just worth having a conversation with your physician. Is there somewhat interfering, or do you even have some of these symptoms that you think might be sleep apnea, or just be aware of those things, before you start taking those supplements.
And if I may add, during those perimenopausal years, those early menopausal years, women are at risk for the most common sleep disorders outside of the effects of menopause directly on sleep.
Yeah.
So I have a low threshold to investigate, women for obstructive sleep apnea, for example, and that would not necessarily be done with a home sleep apnea test, because home sleep apnea tests are really meant for people with a high pretest probability of having obstructive sleep apnea. So those people really need to be tested in the laboratory. And some patients in their perimenopausal years will be evolving from maybe being a snorer in premenopausal times to maybe just mild sleep apnea that then can worsen over the years, but can have impact on daytime functioning, but also chronic insomnia and RLS. So this is a key time in a woman's reproductive life to present with these primary sleep disorders, all of which are very treatable.
And my tip is not just for women. I'm going to do a broader one to keep it simple. There was one question that you asked Nancy, which I just loved, which is, hitting the snooze button. And I'm just thinking about it nowadays. Very few people have the traditional alarm clock snooze button, but you know what they have? Right here.
Yes.
So what is my tip for everyone? I'm going to go this way. Technology, right?
Yeah.
It's going to be something where when it's time to go to bed, put technology out of the bed. I want you to have an alarm, but keep it on the other side of the room, because you know what I'm going to say? I'm not worried about you just looking at a picture of your child or a loved one. It's going to be Facebook and TikTok and my boss is mad at me now. They sent a nasty email. You know what I mean? So it's going to be putting technology away. The other thing is that when we're talking about sleep apnea, one of the trends out there that I've been commenting on nonstop last year, has anyone heard of mouth taping? It's like this, it's this thing where, people, I'm not a hater of nasal breathing. There's some benefit from breathing through your nose, but make sure you don't have obstructive sleep apnea. Right. And, I think that it scares me that once if someone, is putting a tape over their mouth, but they have nasal polyps or a deviated septum, or God forbid, they have severe OSA, they're going to make matters worse. So this is going to be one of those TikTok trends, be careful about,
Mm-hmm.
And I just want to throw those two things out there for the listeners today.
No, I think it's really good, because I think, we go right to Google as soon as we have a problem. We put the symptoms in there or the concerns, and a lot of different things come up. So I wish that we could all have all of you on our speed dial. Because I feel like I thought I knew a lot about sleep, and I learned so much more today. I really did. Any final thoughts before we let you go?
Tamsin, I do want to add one more thing. I know we've talked about menopause. Something, and I would love to see what Nancy and Dr. Raj can add to this. Women in their typically, during pregnancy and their third trimester can have sleep disordered breathing, or maybe show signs of other sleep disorders. And it may go away after pregnancy, but they are at high risk for some of these sleep disorders later in life. And I think it's important for women to monitor that if they realize that they've had something in the past, just to be more aware of that, when they're approaching menopause, to see if some of those symptoms appear again. I would love to hear what Nancy and Dr. Raj have, if they want to add something to that.
Well, my statement's about, we as physicians are doing a poor job in identifying women in many disease states. I'm going to take responsibility. We do a poor job in identifying COPD. We do a horrible job in coronary artery disease, and I think I'm not surprised that we're doing a bad job, at least I am, when we talk about OSA in women around that perimenopausal time. So I think, as I don't know if it was Nancy or you, someone said women present differently in different disease states, including OSA. So that's number one. And I definitely just, once again, wanted just to make sure that I, say my heart goes out to everyone who knows someone with Alzheimer's, who's suffering from Alzheimer's, knows a loved one. I'm in the trenches. And that's why I really, really wanted to be here today, because I was really happy that was an underlying theme. And we don't do enough I really am a big advocate of not lifespan. I'm a big advocate of health span. So it's not just living to 90 or 100. It's doing the best we can, what's available to us, to live that healthiest part ever. And sleep is a big part of it. So just wanted to say thank you for letting me be here.
And such the correlation when we're talking about Alzheimer's. Nancy, any final words?
Yeah, just to speak to Monica's point, it's also important to know that during pregnancy, sleep apnea has direct adverse consequences on fetal development. And so it's just a reminder that sleep is necessary at all stages of life. And we're seeing increasingly number of women who are pregnant seeking evaluations for sleep apnea. I'll plug that Cleveland Clinic has a sleep app on iOS and Android. And this is to screen for the 4 most common sleep disorders that are most prevalent in society: sleep apnea, insomnia, short sleep duration, and shift work disorders. So anyone interested in doing some self-screening can get your sleep scores on our applications and share them with your family medicine provider.
Wonderful.
Oh, if we're doing the plugs, I'm going to plug myself. I have the Dr. Raj podcast. Yeah. It's just about happiness and wellness. And when you look at if you download the podcast, you'll see my face. It does like this.
We love it. We love to see your face. I can't thank you all enough for being here today and all of your insights. It's really been brilliant. And I want to say a special thanks to Healthy Women Prevention and the Women's Alzheimer's Movement at Cleveland Clinic for bringing all of us together today to talk about such an important topic. So we're going to give you some more places for information. For more information on everything you've heard today, you can visit www.healthywomen.org, www.prevention.com, and www.womensalzheimersmovement.org. And of course, a special thanks to your audience for watching. And I hope all of you go home tonight and get a really good night's sleep with what you learned today. Bye, everybody.
Thanks for listening. This has been a production of Ars Longa Media. Our producers are Madison Linden and Chris Brightigan. Our executive producer is Dr. Patrick Beeman. This podcast is for educational purposes only and not intended for medical advice. Ars Longa, Vita Brevis.
Hey, Ryan Reynolds here for Mint Mobile. One of the perks about having 4 kids that you know about is actually getting a direct line to the big man up north. Mm-hmm. And this year, he wants you to know the best gift that you can give someone is the gift of Mint Mobile's unlimited wireless for $15 a month. Now, you don't even need to wrap it. Give it a try at mintmobile.com/switch.
Upfront payment of $45 for 3-month plan equivalent to $15 per month required. New customer offer for first 3 months only. Speed slow after 35 gigabytes if network's busy. Taxes and fees extra. See mintmobile.com.